The word that keeps on coming to my mind is devastating, and that's the way to describe CRPS. It is a misunderstood pain condition. It is sometimes incorrectly diagnosed as CRPS when it's not. Patients are sometimes diagnosed with other pain conditions when they have got full-blown CRPS. CRPS changes over time. Sometimes it's easy to diagnose. Sometimes it's not. It is a beast in my opinion, and it is very hard in some instances to diagnose early. And if you don't diagnose early, it's really hard to manage. Patients have this injury, they've got this pain that is out of proportion to the injury. They get trapped in this vicious cycle where they've got severe pain, no treatment, or very difficult to manage the pain, and this affects levels of function, it affects quality of life, and it can be devastating. Let's talk a little more about the treatment of CRPS. This is merely to give you some ideas of how to treat CRPS, or how CRPS can be treated. This is by no means conclusive and the only ways to treat CRPS. But effectively, there are three ways of treating CRPS. 1, conservative therapies. 2, medications. And 3, interventional treatment approaches as well. Not one treatment is going to help, usually a combination of treatments, and it depends on who's got the CRPS, it depends on their story, it depends on how long they've had CRPS, because CRPS changes. So you might have chronic CRPS, difficult to manage, and for whatever reason you get this acute phase. The treatment for the acute phase of CRPS in chronic CRPS is different to just plain old chronic CRPS. So you've got to reassess things, sometimes repeatedly, to get an idea about where you're at. Early treatment is vital. Treatment using a multimodal approach is vital. Treatment using multiple team approach, so different team members with different areas of expertise, is vital. So let's have a look at the conservative therapies. One of the ways that I would describe CRPS is my job is to try and alleviate the pain so that physical therapists, exercise physiologists, the bottom line is we can get that limb moving again. That is the aim. The aim is movement. Reintegrates that limb with the nervous system. Moving of the limb helps to desensitize the painful features. Moving of the limb helps to undo the neuroplasticity. So movement is vital. Now, sometimes the pain is so severe that movement is very difficult, and that is one of the important medical approaches, is to manage the pain. Sometimes in a short burst of good pain control, whether it be medications or interventions, and again depends on the person sitting in front of you. So physical therapies, aerobic activities, we call it graded exposure, desensitization. So a good pain physio group, a good pain physiotherapist, a good exercise physiologist, it doesn't matter who, but somebody that understands CRPS. And part of this conservative approach is education. People need to understand what is going on. People need to understand why the nervous system is on the fritz. People need to understand that with these therapies you are likely to improve. Occupational therapy, so focusing on that hand or foot as a unit and how it functions with the rest of the body and with the rest of the world. So physical therapy, occupational therapy, vital aspect, and good physios, good OTs know exactly how to manage CRPS. You've got to be experienced, you've got to know what you're dealing with, because the treatment and approach for CRPS is different to the treatment and approach for somebody that's recovering from a hand surgery or foot surgery. Sometimes mirror therapy is used. There are many different techniques that good allied health teams will use to retrain that part of the body, will reintegrate that part of the body with the nervous system. Graded exposure therapy, mirror therapy can sometimes be used in a similar way that we use it for people that have had amputations. Mirror box therapy can be used for CRPS and can be a very important way of reintegrating that nervous system and normalizing nervous system function again. I don't know about acupuncture. I think putting acupuncture needles in an area that's exquisitely painful may stimulate or may stir things up, and I generally tell that to people. But nevertheless, this is quite a good paper published this year with some updates on CRPS, so I'm using this as a means. There have been some studies showing that TENS machine might be helpful. It's very low risk, and it can sometimes be helpful again. But I'm concerned in people that have got very high levels of neuropathic pain that some of these things might stir things up. But conservative therapy, a very important, vital, pinnacle, top of the pyramid approach to CRPS. We've got to get that limb moving again. Number one. Number two is education. People need to understand what is going on, why it's happening, and how we can get back on top of it again. So that's the conservative approach.